there are common adverse effects across CAR T cells and bispecific antibodies, and they can be broadly divided into 4: cytokine release syndrome, neurotoxicity, hypogammaglobulinemia, and low blood counts. So what exactly are these 4 adverse effects, right? Cytokine release syndrome is actually a supraphysiological, massive inflammatory response to the CAR T cells, the bispecific antibodies that are going inside the body and attacking the multiple myeloma. How do we diagnose it? It's either a standalone or a combination of these 3 clinical factors. Patients tend to have fever, low oxygen saturation, and low blood pressure. The treatment of cytokine release syndrome includes fluids, a drug called tocilizumab, which is directed against interleukin-6, corticosteroids, and a drug called anakinra. Neurotoxicity is another concern that accompanies CAR T cells and bispecifics. However, the incidence of neurotoxicity is very less, so this is not a major concern. But when it do occur, we're always on the lookout for these symptoms, which include confusion, memory loss, delirium, seizures, motor symptoms like unable to move hands or legs, and raised intracranial pressure. Neurotoxicity is usually transient and is treated with corticosteroids, anakinra, tocilizumab, etc. As we increasingly use CAR T cells and bispecific antibodies, we are now finding that hypogammaglobulinemia and low blood counts are a major side effect. Hypogammaglobulinemia essentially means that the amount of immunoglobulins in your blood is very low. And this happens because the CAR T or the bispecific has gone in, killed all the plasma cells, which are cancerous, but in addition also ended up killing some of the normal hematopoietic cells and some of the normal plasma cells. So they're not able to produce the normal amount of immunoglobulin that is required to keep antibodies, that is required to generate antibodies to keep infections at bay. The diagnosis is often achieved when we check antibody levels every month after these treatments. And if the IgG antibody level is less than 400, we have a diagnosis of hypogammaglobulinemia. Hypogammaglobulinemia predisposes patients to have infections. We have patients coming in with recurrent infections every 2 weeks, having a sore throat or a cold, and when we check their antibody levels, they're low. How do we treat it? When these antibody levels are low, we give them what is called IVIG or intravenous immunoglobulin every month until the IgG levels recover. Last but not the least, we are seeing low blood counts after CAR T cell and bispecific antibody treatment, and these low blood cell counts can be a combination or a standalone of low white blood cell, low hemoglobin, or low platelets. We manage them supportively by giving blood transfusions when needed, platelet transfusions when needed, and giving growth support like recombinant EPO, TPO agonists, or GCSF as indicated for white blood cell counts. So this is an overall summary of how we deal with the adverse effects of CAR Ts and bispecifics. It's a very exciting space in 2023 with all these drug approvals, and we have multiple clinical trials that we are expecting to read out over the next 2 years that are going to bring many more treatments to patients with multiple myeloma. Thank you so much for your attention. My name again is Sridevi Rajeeve. I work at Memorial Sloan Kettering, and it's been my pleasure to have this session for Grace. Please find me at Twitter, which is now called X, at sridevirajeeve@gmail.com. Thank you.